Part 4. Discharge from the hospital. Discharge from the hospital usually occurs 1 to 3 days after surgery. Please ensure that your coach or a designated family member or friend is available to drive you home. Discharge from the hospital generally occurs at 12 p.m. If needed, you may be transferred to a subacute or acute rehabilitation center if your insurance authorizes this. At this point, you should follow up with your surgeon anytime between 1 and 4 weeks after surgery.
Home is the best place for recovery for many reasons. By going home, you have a much smaller risk of developing an infection. Your home will be the most comfortable place for you, which will help you to relax, rest, and heal. By returning to your normal living habits, you'll experience less of a disruption to your overall life. Your wound may be closed by either metallic staples or sutures. To protect your incision, you may have steri-strips on top of the staples or suture, and on top of the steri-strips there may be a gauze dressing or a clear, plastic-like bandage. If you have this clear bandage, try to keep it on for as long as possible. If it starts to come off on its own, you may have to carefully remove it, taking care not to disrupt your staples or sutures. If you have the gauze dressing, it may fall off by itself at any time and does not need to be replaced. For steri-strips, they should remain intact for at least 7 to 10 days until they fall off. If the steri-strips start to peel off at the edges, you can trim the edges. If they happen to fall off before the wound is closed, you should begin applying bacitracin ointment directly on the wound until it is closed. Bacitracin can be purchased over the counter from your local drugstore prior to surgery so that it is readily available if you need it. For staples, they may or may not be covered by steri-strips. If the dressing or bandage has fallen off and there are no steri-strips on top of the staples, bacitracin should be applied on the wound. The staples should remain in place until 2 weeks after your surgery. This is when you should schedule an appointment with your surgeon to have them removed.
As previously mentioned, the more active you are within moderation, the quicker you will heal. Rest and take your pain medication on an as-needed basis, remembering to take the lowest dose at the least frequency you can tolerate. Following this principle, it is important not to take more than your doctor has prescribed at once, and if you are feeling better, we recommend you reduce or stop your pain medication completely. You should wean off narcotics as much as possible within the first 30 days after surgery to reduce risk associated with narcotic use. Remember, after surgery, regardless of the region operated on, you will not be allowed to bend, twist, or lift anything more than 5 pounds. If you are having a cervical fusion, you will need to wear your collar continuously except during eating and showering. Your physical therapy team will advise you prior to discharge on whether you can go up and down stairs.